Good evening, good afternoon, and good morning. This is the 1753rd day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Neha Kakkar. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again. You can share it with your friends without paying any money. You can subscribe the same without paying any money. And the purpose of this forum is to take homeopathy to every home around the world. And please support us in promoting homeopathy among public. And let me come to today's guest. As you all know, today our guest is Dr. Neha Kakkar. She has completed a B.H.M.S from Delhi and is a practicing homeopathy physician, and she's the owner of Homeocure and Care Clinic, Meerut, Uttar Pradesh, India, and one of the chief moderator of IFPH, and she has done moderation in English as well as a regular presenter at IFPH with various presentations. And all the presentations done in this forum are excellent. And she is a member at Red Cross Society, Meerut, South Delhi Homeopathic Association. And she had made a presentation on the topic of cancer, its homeopathic etiology and management at All India Homeopathic Congress held at Hyatt, New Delhi in 2023 December. Today, Dr. will be discussing about different aspects of psychology and its correlation with homeopathy. As we all know that homeopathy is a system which is directly connected with mind, and so naturally psychology come into the picture. And let's see what are the things Dr. Neha Kakkar to say in this evening to us. Welcome, Doctor.
Thank you, Dr. Dinesh. And thank you for giving me again the opportunity to present on IFPH. It has been a wonderful journey. After joining IFPH, I've been in continuous touch with all the doctors here, Dr. Dinesh especially, and special thanks to Dr. Dinesh and Dr. M.K. Sahani sir for introducing me into the forum. And it has been a very wonderful and enjoyable journey while presenting and also while moderating the sessions in English and Hindi. So without wasting any more time, let's start with our topic today. I'm going to share my screen. Is my slide visible?
Yes, yes. You
Yes.
can make it big.
So the topic for today is different aspects of psychology and its correlation with homeopathy. As Dr. Dinesh said, that homeopathy is a system which is very much connected to the mind, to the thoughts, to the thought process, what actually an individual is feeling inside, what he or she is thinking, how the psychology works inside, and how it is related to homeopathy. Homeopathy is a system which is based, we can frankly say, which is based on mind itself. The mind is the foundation for homeopathic practice. So psychology as a subject, as a clinical subject, we should treat it as a separate subject, and also with adjuvant in homeopathy. And I would like to say here that psychology should be, as a main subject introduced into our curriculums, and we should use the different aspects, especially the diagnostic and the, the test aspects, the clinical aspect, how we, observe the patient, that aspect of psychology, how we can, divide the diseases, and how we can use different clinical parameters. Like I said, different diagnostic tests. There are different questionnaires in psychology, which we'll see further in these slides. we can, add all those things with homeopathy and increase our practice and take our practice to the next level. We are going to see that, and we are also see the homeopathic aspect and also the psychological aspect. We are going to co-join them in this presentation. So moving ahead, first we are going to see that Dr. Henneman obviously was a true psychiatrist. He was one of the earliest, if not the very first, to advocate the treatment of insane by mildness rather than coercion. In the medieval period, when Dr. Henneman was practicing around in the 17th or the 18th century, this was the period of oppression. I mean, individuals and as a society, it was a suppressed society. People were not allowed to express themselves. They were very suppressed. So there were like an epidemic of mental diseases. There were many mental diseases, like especially like hysteria and depression, anxiety, delusional disorders were very also common at these time. So, and there was a lot of growth of mental asylums at that time, and the mental patients were treated in a very very you can say very cruel manner, because they were kept in very unhygienic conditions. They were not taken care of. They were tied to chains, and they were subjected to various tortures just to see take that the disease out of their minds, because the disease of the minds were considered very like जिसे कहते हैं ना अछूत बीमारी. It was considered very bad to have a mental disease, and it was viewed as a taboo. So these people were kept in different mental asylums, and they were treated very badly. They were not treated as humans, you can say. So Henneman was one of the first you can say doctor or a person, or here we can say that a psychiatrist who tried to advocate that you should treat the insane with mild treatment, especially when he discovered homeopathy, that they should be treated mildly, gently, and as a human being. So this was very evident of his treating of certain patients in Clockenburg. That was a place where there was a mental asylum opened by Dr. Henneman. In 1792, he went to Georgenthal in the Principality of Gotha to take charge of an asylum for the insane and to treat Clockenburg. There are several different accounts of this period of life. And here, this institution was erected by Duke Ernest of Gotha. That was the like the main person or the chief minister of that area, and he was appointed manager by the Duke and opened the institution in the beginning of August. And Dr. Henneman cured the chancellor's private secretary who had become insane. So the main person who was running that asylum, that person's private secretary was treated by Dr. Henneman. And there was some controversy whether this asylum was running previously or not, but it was confirmed that Dr. Henneman treated certain insanity cases in this asylum. And the wife of Mr. The Chancellor, that is F.A. Clockenbrigg, his name was F.A. Clockenbrigg, secretary to Chancellor of Hanover, saw this article. The persons who was insane, his wife saw that article by Dr. Henneman. He wrote some article on homeopathy and something, and also he this Madam Clockenbrigg took an interview with Dr. Henneman, and she was very much impressed that how Dr. Henneman had discovered this new system of medicine, and he was treating different difficult patients and chronic patients with homeopathy. It is written, she was so much impressed with the article and interview with Henneman that she desired to take him charge of the case of her husband. To this he consented, but as he had no place in which to treat this violent madman, and no doubt the Duke of Gotha was also interested in the cure of so much distinguished a man, as much as was Henneman himself, the following arrangement made. So to treat that person, a wing of his castle at Georgenthal that was converted into a asylum like thing, and Dr. Henneman started his treatment. In the winter of 1791, a most fearful madness developed. He was brought to the asylum toward the end of June in a melancholy state, accompanied by strong keepers. His face was covered with large spot, dirty, imbecile in expression. Day and night he raved. He was very restless, afflicted with strange hallucinations, imagining himself in many positions, would recite in Greek actual words of the Hebrew text, a Bible story to his keeper. He lived in terms of amity with emperors and queens. He destroyed his clothing and bedding, took his piano to pieces, and wrote a one-time prescription for his own cure. So he was so insane. You can see the insanity symptoms here, different symptom of the mania that he showed. Hahnemann remarks that for 2 weeks he watched him carefully before giving him any medicine. At the period of which we write, the usual treatment of all forms of insanity was by violence, by chains, abuse, whipping, and dungeons. So they were treated very badly. So Hahnemann, the thing to observe here that Hahnemann observed him only for 2 weeks. Only observation part was done for 2 weeks. For example, if we are seeing any patient, we are in a hurry to prescribe the medicine. But Dr. Hahnemann first and foremost observed him for 2 weeks, and after that, he came up with his treatment. And here the accounts of how the insane were treated. They were treated like wild animals, corporal chestnut, nauseating medicines were used. But Hahnemann did not adhere to this cruelty and never allow an insane person to be punished either by blows or any other kind of corporal chastisement, because there is due punishment where there is no responsibility, and because these sufferers deserve only pity, and all was rendered worse by such treatment and never improved. So he was against all these the cruel way of treating the insane. And in this asylum and by this case, he treated a very major case of insanity, and also other some other cases which we can find in it's very difficult to find the written account of these. But if you read the literature about Hahnemann, you need to search them. You can search on the internet, then obviously you can get it. Here only I have mentioned one case of what Dr. Hahnemann treated. So moving on to our organon, mental diseases and organon, as mentioned by a great master, Dr. Salman Hahnemann, in the different aphorism, the concept of mental diseases, their probable causes, along with importance of mental symptoms in homeopathic practice. Also, he mentions about how to take a case in a mental disease scenario. Let's see these aphorisms one by one. So, organon is the main book, which is our Bible, and from where we can, make or break our practice. It is the main book which is our guiding. Materia medica is only the knowledge of the drugs, but how to apply this knowledge in our practice, how to see, how to take a case, how to observe a patient, what to observe in a patient, how we need to see what drug is coming up, we need to make the drug picture, how to note the P occurrence. This all is mentioned in the organon. And from aphorism 210 to 230 is the are the aphorisms where mental diseases are taken into account. From aphorism 210 to 220, Dr. Hahnemann advises how and why the mental disease occurs, what are their main symptoms, and how we should observe and take the case of a mental patient, and how we should take up the symptoms and what symptoms we should be looking for, and what exactly the mental diseases are and how they occur. And from aphorism 220 to 230, Dr. Hahnemann tells how we can treat these mental diseases by homeopathy, and what approach we should carry, and how the mental diseased patient should be treated. So we'll take these aphorisms very quickly. I have made some notes. I'll quickly, sum up these aphorisms. Mental disease have their origin in sora. Totality of symptoms need to be noted. Only mind is always altered. Homeopathic medicines have the capacity to alter the mind of the patient. So here he is saying that mental diseases start in the sora, and only homeopathic medicines have the power to alter the mind. The homeopathic medicines can change an obstinate, violent, or hasty, and even an intolerant patient into chaste and a modest character. And the clear-headed patient can also become the opposite. So a healthy patient can become a diseased patient through the application of homeopathic drug proving, and opposite can also occur when we apply that homeopathic medicine on a mental disease patient. He can be converted into a calm and cool personality from a violent one. So only homeopathic medicines have these power, and the mental diseases have their seat in Sora. This is what aphorism 210 says. Aphorism 211. All states that disposition of the patient often chiefly determines the selection of homeopathic remedy. The characteristic symptom of the patient is the deciding factor in choosing remedy. This is very much known to us, that the characteristic symptom and what disposition the patient is carrying, what how is he vulnerable to different environment factors, or he makes a wall of himself. Like in certain remedies like pulsatilla, silicia, they are very sensitive patients, but in medicines like kalicarb, lycopodium, they have a different image outside and different image inside. So these are the different dispositions which bring out different mental diseases, and we need to see this and observe this disposition and the characteristic symptom to see the patient in a mental disease while choosing the remedy. 212. God has regarded the feature as important that every medicine has different powers to alter the diseases and mind of a person. Here I'm not reading the full aphorisms because it is very long. I have just made certain important points from these aphorisms, and I'm trying to take out the gist from it and providing all the knowledge here. So the God has regarded the feature as important that every medicine has different powers to alter the diseases and mind of a person. So God has put these medicinal powers to alter the mind of the person and also to cure the mental diseases. Aphorism 213. Importance of mind symptoms in selection of homeopathic remedy. The changes in mind and disposition need to be selected for patient's relief. That too, that medicine which produces a disease-like state in a healthy individual. Here he is stating the similia, similibus curanter, that a remedy which is producing similar symptoms in a healthy individual will cure those same symptoms in a diseased individual. Aconite will cure a patient with calm and afferable disposition. Aconite will never cure a patient with calm and afferable disposition. Aconite a patient needs to be fearable. A calm patient can never be cured by aconite. Pulsatilla will never cure a patient who is happy, gay, and obstinate. So we need to see the similarity of symptoms in the disease and in the remedy, and according to that, we need to prescribe the homeopathic medicine. Aphorism 214, the instructions given in cure mental diseases may be confined to a very few remarks. The mental diseases are removed from the body and healthy individual by producing a morbid symptoms as in a healthy individual. That is similia similibus curanter. This is what Dr. Henneman is asserting. The law of similia is asserted in aphorism 213 and 214. Now, 215, a very important aphorism. Mental or emotional diseases are nothing more than physical disease in which symptoms of derangement of mind and disposition peculiar to each of them is increased. Mental diseases are not separate from physical diseases. These are the same physical diseases which have made their seat in the mind, and they had made the mind their home. The same disease which we were afflicted in the body, any disease which was previously afflicted in the body now has taken its seat in the mind and taken a shape of a very different disease, which we call it as a mental disease. So here he is trying to say that mental disease is not different from physical disease. It is also very similar to that physical disease which has taken its seat in the mind. It has affected the mind, and which we think as a separate disease than from the body, but that's not the case. He's just trying to say that it is the same physical disease taking its seat in the mind. 216. Conversion of physical symptoms into mental symptoms. It is not uncommon when a physical disease that is fatal or life-threatening in nature, example, a suppuration of lung, some other disease, acute disease, becomes transformed into a mental disease like insanity, a kind of depression in where the fatal physical disease lose the danger or becomes less in intensity that only a very gifted physician can observe. So he is here saying the physical disease, like for example, if somebody is having a suppuration of lung, any tubercular suppuration or pleurisy or any other acute manifestation of a physical disease, it is not uncommon that that acute physical disease is converted into mental insanity or depression or anxiety, because that, as I said in the previous aphorism, the physical disease has changed its seat. Previously the seat was lungs or kidney or some other organ like stomach. He might be having some ulcers or some bleeding, but that bleeding has now stopped, and now the depression or anxiety symptoms come up suddenly in a patient. So in this way, the physical disease gets converted into mental disease, becomes only one-sided disease, and the mental disease, which was very slight, becomes the chief complaint. Here, the physical disease gets converted into spiritual and emotional disease, that is from grosser to subtle plane, where the surgeon or allopathic physician can never reach with its knife. The allopathic physician will never know this, that this mental disease is the same part of the physical disease. Only a homeopath with this acute observation can observe that this is the same physical disease that is being converted into the mental disease. It is being transferred from the grosser, that is from the physical level, to the subtle emotional or the mental level. Aphorism 217. In these kinds of diseases, we must be very careful to take the whole case, including physical symptoms and also the mind symptoms, to extinguish the entire disease among the remedies whose pure effects are known as on healthy individuals. We should take the whole case. The physical symptoms should also be taken into account. All the past physical symptoms, all the present physical symptoms, along with the mental symptoms, should be taken while taking the case. These are very important. And the remedy, which includes symptoms which are physical or mental symptoms in whole. So the whole picture of the case needs to be taken into account when choosing the remedy. We should not leave the physical symptoms behind. Aphorism 218. The whole case taking should include collection of symptoms which should have all the symptoms of physical symptoms before it degenerates into one-sided increase in physical symptoms and becomes the disease of mind and disposition, must be learned from patients and friends. All the symptoms should be also collected from the patient's relatives, from patient's friends, either from the father, mother, or from the child, or from the siblings, so that we get a whole case out of it, and on the basis of that we can prescribe our homeopathic medicines. Aphorism 219. The previous physical symptom present be greatly taken into account, even the same seem to be less perceptible and has been converted into psychic disease. These prove to be great help to select the remedy. The same thing is being repeated here, that we need to take whole symptoms, the previous symptoms, the present symptoms, and all the symptoms which we observing, which we are seeing, which we are inferring from our observation, which we are getting from our relatives, from the friends and the family. So whole case then becomes the basis of our prescription. 220. Importance of giving anti-miasmatic remedies. Now, the how to treat the mental patient. As I told you, 220 to 230, Dr. Henneman is going to tell that how we need to treat the mental patients. The patient, friends, and by the physician itself, we have constructed a perfect whole picture of the disease. In order to bring homeopathic cure, or also in such cases where mind symptoms are coming, antisoric or anti-miasmatic remedies should be prescribed, where physical disease have already lasted some time. Miasms form the basis of disease. They start as through the brain, thus the psychic cause of disease. So here he is stressing on the anti-miasmatic part of the prescription. We need to take the account into the miasm which is working behind that miasm. We need to observe whether it is sora, it is psychosis, it is tubercular, it is syphilitic. That is the work of the homeopath, to observe the the basic cause, the psychic cause of the disease, and that forms the miasm of the disease. And that what is Dr. Henneman stressing in this aphorism. Moving on to aphorism 221. In insanity or mania or any other mental malady have suddenly broken into acute diseases in patients. Otherwise, the origin is always sora. The acute exacerbation should always be treated with acute medicine and not an antisoric. Now, if in the course of a chronic mental disease, if we get an acute outburst of certain symptoms. Like for example, person is suffering from chronic depression and he is having the symptoms of forgetfulness and depression, crying, loneliness, insomnia. And suddenly in between the course of the treatment, you're treating the patient with an anti-miasmatic, like you're treating the patient with an atramure. But in between, he's having an acute attack of anxiety where suddenly the patient starts having certain palpitations, या घबराहट होने लग गई, या मुझे चक्कर आ रहे हैं, या फिर मुझे डर लग रहा है कि मैं मर जाऊंगा. तो these kind of acute symptoms, or any acute physical symptoms also, if they are coming, like he's having breathlessness, or he's having a bout of cough, or he's having acute pain somewhere. So during those course of chronic treatment, we need to give an acute medicine in between to treat that acute exacerbation, and with acute medicines like aconite, belladonna, hyoscyamus mercury to subdue it. And until the stage when the SORA will revert back. The original chronic disease will always revert back because that is running in behind. The acute exacerbation is due to certain external influence, but the chronic disease which is running behind is always there. That needs to be treated with anti-miasmatic, and the acute part with the acute medicines. Aphorism 222, the patient who has recovered from an acute mental disease from acute acting medicine should never be cured, and in contrary, no time should be left to give antisoric treatment, and has become more latent as it is ready to bring a new attack again. But if treated with antisoric, then will not be afflicted with same disease again if follows diet and regimen prescribed to him. It is rare for a mental or emotional disease to cease spontaneously as the internal dyscrasia of sorrow transferred to a grosser corporeal organ, where the person is dismissed as cured. So the SORA which is running behind, the miasm which is running behind, is not at all cured. We need to cure it with anti-miasmatic treatment. Otherwise, it will again come back and attack other organs, also produce a new disease, and can create a new kind of disease. So we should not leave that anti-miasmatic treatment. We should not leave the SORA, the psychosis, or the syphilis, and anti-miasmatic drug should always be given. If the antisorics, moving to 223, if the antisorics are not given or anti-miasmatic treatment is not given, then we expect even from a slightest cost, insanely, the speedy occurrence of a new or lasting severe disease, which miasm expresses itself fully, that converts into a combined mental derangement, which is not able to be cured by antisoric also. That means miasm need to be cured at a specific time. Otherwise, the miasm will develop into mental derangement, which will get very difficult to cure. If we don't treat the miasm at the correct time, it will get converted into a very full-blown mental disease, or a very complicated mental or physical disease, which is very difficult to cure because it will develop into a pathological state. So we need to give the anti-miasmatic at the very correct time, at the right time, and we should not let the disease progress to a level when it is not, we are not able to treat or cure with our medicines with homeopathy. So anti-miasmatic treatment should be done at the correct time. Moving on to aphorism 224, if the mental disease is developed from a faulty education, bad practices, or neglect of mind, they will benefit from psychotherapy and sensible advice. But if the mental disease arises from a deeper cause, like a miasmatic cause, then it would be speedily aggravated from the sale. It will not be cured, but will increase in intensity. Whenever there are certain mild, mental diseases which are caused by, faulty education, bad practices, corrupt morals, certain, bad influences in the environment, they can be very easily cured by psychotherapy, counseling, only by counseling or only by psychotherapy. We don't need any drugs. But when the cause is very deep, there is constant trauma, constant abuse, or constant, neglect of a person's feelings, or, over abuse of certain feelings. We'll see in further in the slides also. So those cases need a proper homeopathic remedy to them to be cured. Otherwise, they will increase in intensity. They will not be cured, and they will furthermore aggravate if we are not providing the right treatment, the right drug, and only applying the the counseling part, और नहीं ऐसे ठीक हो जाएगा, उसको समझाने से हम ठीक कर लेंगे, ऐसा नहीं होता. कुछ cases में obviously you can make the patient understand that this is the cause, you should remove these thoughts, or you should not think like this, you should adopt positive thinking, you should do meditation and all those things. But most of the chronic diseases having their seat in, deeper emotional causes or psychic causes, we need a homeopathic treatment. So moving on to 225, those mental diseases which arise from corporeal diseases, but rather from emotional causes, this is continued anxiety with frequent occurrence of fear, will also destroy the physical health, often to a great degree, and are also difficult to treat. Obviously, the chronic psychic diseases and mental diseases also destroy the physical health of the patient and are very difficult to cure. Moving on to aphorism 226, importance of psychology in homeopathic treatment. These emotional diseases which were caused by causes mentioned in aphorism 225 are not in chronic nature and also not entered in the physical body, may be treated with cyclical remedies and along with applied adjuvants of psychology can be brought into a rapid cure. Also, healthy diet and regimen needs to be followed. Here he is talking about the adjuvants, a healthy diet, a healthy environment, a healthy, using psychotherapy and counseling along with homeopathic treatment. He's talking all these adjuvants about. And in the next aphorism of 227, again, he's talking about the importance of anti-miasmatic treatment. The fundamental causes here is also psoric miasm, which should be treated in time with an anti-psoric remedy. Otherwise, the seemingly cured and treated patient will again fall into the claws of the psora. And again, the mental disease. The same thing is being repeated here. Aphorism 228, only carefully selected homeopathic medicines brings relief to such patient. Dr. Henneman warns allopaths to avoid such harsh behaviors towards mental patients who are labeled as criminals by doctors and whom physicians vent out their frustration of not able to cure them of their mental remedies. Here he is, saying a word of caution to the doctors that they should not behave harshly, cruelly, and they should behave the mental patient as humans. It is a very common practice to shun off the mental patient. Now obviously the scenario are changing, but previously also, even we can say 50 years back, we can see that many person who is having any mental health problem is seen as a taboo, is not treated well by the family members, even by the friends, and even by the doctor. The doctor also thinks like ये तो सिर्फ इसको तो सिर्फ सोचता है, ये तो सिर्फ सोचने की बीमारी है से, he is only thinking, he is only overthinking, that's why he is diseased. But that's not the case. The patient is obviously very diseased and he is having a problem which is getting into his psychic, into his mind, and they also tend to vent out their frustrations. That if that patient is not, they are not able to cure any mental patient, then also they vent out the frustration on the patient and say ये तो पागल है, ये तो ठीक ही नहीं हो सकता, because they are not capable to cure them. They don't know how to take the case, they don't know how to observe the patient, they don't know how to apply their knowledge, and they don't have their knowledge. So we need, as a homeopath, we have this power to observe the psychic symptoms of the patient, the mental symptom of the patient, and treat especially the mental diseases with utmost affection, with utmost care, and in a very gentle and rapid manner as advocated by our master, Dr. Henneman. Moving on to 229. 228, sorry. Treatment of the insane should not be tortured and tormented with inhuman treatment. Surrounding to be cleared to ensure safety of patient. The surroundings should be clear and which ensure the safety of the patient and also of the relatives. The mental patient needs to be treated as a human possessing intelligence and reason. He who is diseased due to faulty circumstances or continued grief, anger, depressions, or vexation is in this state not by own fancy, so should be treated with respect and dignity. So Dr. Henneman is saying we should treat the patient as a human who is possessing intelligence. He is an intelligent person who is diseased. He should be treated with respect and dignity. Contradiction, root corrections, eager explanations, or harsh, inhuman treatment of the person suffering from mental maladies are not good modes of treating them. Such patients are all the more aggravated from such treatments. Obviously, the patient will be aggravated because he is a human, he is feeling. We need to be treated with respect and dignity. He need to be heard. We need to see कि उसको problem है. He is having a problem inside the brain, inside the mind. What he is exactly feeling. We as a homeopath needs to be a friend, a confidant in which a mental diseased patient can, pour his or her heart out. You need to be more as a friend. Whenever a mental diseased patient, whether of depression, of anxiety, of bipolar disorder, or autism, ADHD, whatever these kind of cases you are seeing in your clinic, should always lend a very patient, a very considerate, a very compassionate ear to the patient. You should see that whatever the patient is seeing, we should not, uh, give him lecture या हमें उसे प्रवचन नहीं देना है कि हम आप ऐसा करो नहीं, आप ऐसा सोचो, आप ऐसा करो नहीं. We need to hear him out first, then we need to plan out our action. Obviously meditation and counseling are very important also in as we are saying that psychology is important, so those things play a very important role. But to select our remedy and to make the patient feel that he is being heard and he's being uh, taken into consideration, because the main problem with mental disease patient is they feel worthless. They feel that my emotion and whatever bad thoughts I'm having, they are worthless. But they are not worthless. They are coming due to certain problem, what a problem the patient is facing. So we should have a very, very compassionate ear to the physician, and what this is what Dr. Henneman is seeing here. So the last aphorism of 230, he's saying homeopathic medicine, especially anti-miasmatic ones suited to each particular mental or emotional patient, can cure the mental disease in very less time as compared to large doses of allopathic medicines. He asserts the superiority of homeopathic system over allopathic system on mental diseases of long regions, will originally sprang from either the physical or mental causes. So here, in the last aphorism, he is saying that homeopathy carries an upper hand in treating mental diseases, and that is very obvious. Allopaths or allopathic medicines do not possess those power which a homeopathic medicine has, which can treat these mental diseases, these mental symptoms, or any physical symptoms or physical diseases which has been converted into mental diseases. So in a gist, we can say that organon in these aphorisms, Dr. Henneman has advocated how to take the case, what to see in a mental disease case, how to approach the treatment, how to take care of the mental disease patient. This is the A to Z of what Dr. Henneman says about mental diseases. Now, moving on to the psychological aspect, the clinical psychological aspect. As a subject, psychology is a very exhaustive and vast to study, but to integrate with homeopathy, we just need to understand some very basic concepts of psychology. There are many psychologists who have contributed a lot to a field of psychology. Here I am mentioning a few: William Took and Dorothy Dix, who worked to provide more human and better hospital facilities for the mentally ill. Like Dr. Henneman advocated, humane treatment of the mentally ill. So similarly, these doctors of William Took and Dorothy Dix were the ones, who opened mentally asylums with, very good facilities to take care of the mentally ill, because before that they were treated very badly. Other name is Clifford Beers, who wrote a book titled Mind, which mentioned his experiences as a mental patient living in a mental hospital. He was a doctor and he went to a mental asylum living as a mental patient. He himself became a mental patient, and he observed how those mental patients were treated in a mental hospital, and basis on that he wrote a book named A Mind. Dr. Leitner Whitmer established the first psychological clinic with referral of a boy who showed an odd spelling problem. So first psychological clinic where psychological cases were treated was opened by Dr. Leitner Whitmer. So these were some of the important names in psychology. There are hundred and numerous of psychologists and psychiatrists. Recently, I have completed my course in a diploma in psychology. So there are n number of doctors who have contributed to the field of psychology. But these are the names I can mention here. And further, we are going to say the name of Dr. Sigmund Freud, a very known name in field of psychology. His theory changed the face of psychology and what we know it of today. In the present scenario, Dr. Sigmund Freud's psychology theory is the main theory on which all the psychiatry, all the psychological treatment is based upon. He was inspired by a neurologist named Jean Charcot, who studied hysteria patients using psychological approach. As I mentioned earlier also, there were a lot of hysteric patients, especially women patients had a lot of hysteria because women were not able to express their desires, their feelings, and they used to have these hysterical attacks where, suddenly either used to faint down or used to have, palpitations. या फिर they used to, had episodes of bouts of crying. So these all symptoms were, labeled under the symptoms of hysteria, where they were, suddenly coming up into, bouts of crying or bouts of anger. Suddenly they used to have, excruciating body pain, or, they used to faint. So these symptoms were very common in women, and they were classified under the topic of hysteria. And Dr. Jean Charcot was studying on hysteria, and Dr. Sigmund Freud was very much inspired by that study, and he, along with Dr. Brewer, published studies of hysteria. This publication served as a launching pad for psychoanalysis, the most influential theoretical treatment developed in psychiatry and clinical psychology. So now moving on to Freud's iceberg model. Dr. Freud gave an iceberg model and the theory of ego, id, and superego. Now, what is id, ego, and superego? Id is our innermost desire, our innermost mind, our innermost feeling, what we want to do in life, what we need to, how we need to express ourselves in life, what we like, what we don't like. This is our id, our innermost core, the unconscious mind, or we can say our innermost feeling, what exactly as a personality we are. That is our id, which is god gifted, which we are born as. But what happens, we are conditioned by the society. We are told that we should not do this, we should not do that, we should behave in a certain manner. हमें ये नहीं करना चाहिए, हमें वो नहीं करना चाहिए, हमें इस तरह से certain behave करना चाहिए, हमें इस तरह से बोलना नहीं चाहिए, हमें ऐसे हंसना नहीं चाहिए, हमें ऐसे रोना नहीं चाहिए. सोसाइटी हमें हंसने या रोने भी नहीं देती है. तो दिस बिकम्स आवर ईगो. एंड व्हाट इज सुपर ईगो? सुपर ईगो इज the morality, given our by religions and, our religious teachers, and even by the society as a whole. So this id is our innermost core. Then comes the ego and the super ego. So this id is gets most of the time suppressed, and which is the main cause of, giving rise to different mental diseases. And he also advocated these psychosexual stages of development, where we see an oral stage from the birth to 1 year of age, where the mostly the gratification of the senses is from through the mouth. The child only knows how to, suck the milk or take the food from the mouth, and he's happy doing that. So he is getting satisfaction from the mouth. Then next is the anal stage, that is from first year to third year, where the child learns how to go to the potty, how to urinate. So all the release of energy is from the anal region. So that is the anal stage. Third is the phallic stage, from 3 years to 6 years, the penis or clitoris, when, sometimes the children, experiment with their sexual organs, and, they discover that what actually the sexual organs are there. So this is the phallic stage. So here we see the ego is developing in the oral and anal stage, and superego is developing from the phallic stage, where, the religion, you tells that it is wrong to feel sexually, but this is a very natural part, and the experimentation starts from 6 years, you can say. Genital stage, it is from puberty, latent stage from 6 years to puberty, little or no sexual motivation. So this is a latent state where there is like a repression, because the ego and superego has suppressed the id. It has suppressed the sexual feeling, which starts at 6 to 7 years of age. So there is a latent state. Then comes the genital stage, when the puberty bursts out. Puberty to adulthood is the genital stage, where the main gratification of senses is through the sexual organs. So this psychosexual stages was advocated by Sigmund Freud, and it was very much controversial also, because suddenly it was all over the place that repression of the sexual desires is causing all the disease. So it was very much into, controversies, and it was rejected by many doctors and psychologists also. But later on, and we also see in homeopathy that repression of our desire, whether sexual or non-sexual, also give rise to certain diseases. Repression also and excessive indulgence of those emotions also give rise to certain diseases. So this was the main psychological thing which was given by Dr. Freud. The iceberg model we saw of ego, superego, and id, and then we see of Freud psychosexual development. So what is the psychological basis? As I said, suppression of id or over-intelligence to gratify the id. Id is the main cause, the subconscious, the innermost core. If we suppress the id, then also we get the diseases. And if we over-indulge or if we abuse the id, then also we get the diseases. And here we see the different rubrics which we can correlate with the psychological suppression of overintelligence, ailments due to suppressed anger, ailments due to suppressed grief, ailments from suppressed sexual urges, from suppressed ambitions, due to excessive intelligence of alcohol or drugs, from sexual abuse, from excessive anger, and from overexcitement. So here I have clubbed both those things, from suppression also and overindulgent or excessive intelligence also. Now, this is also a very important part where we see psychological testing in homeopathy. Here, this part is, unexplored in our as a homeopath, because we don't use the psychological measures or the diagnostic part, which we should be using to diagnose the mental diseases, and also different questionnaires and psychological tests. Like for example, if I don't know if you go to a psychiatrist for a psychological evaluation, they first thing they do is they give you a questionnaire. They have different, very variety, different types of questionnaires which they give you. You have to fill out those forms, and on the basis of that, they give the diagnosis of psychological disease, what disease you are having, and what symptoms you are experiencing. So, in this similar way, we as homeopaths need to treat these psychological disorders with using these tests, and we should use this investigation test. And then after that we should employ our homeopathic medicines and again conduct those tests. I know it is a very difficult task in many cases, because once the patient gets cured or he gets leave, they don't again go for the test. But if we want to prove our mental in evidence based homeopathy, then we should be using the psychological diagnostic test, and after giving the homeopathic medicines, we can again repeat this test and see the before and after and provide an evidence-based study. So moving ahead, the psychological test to test intelligence, we can use these intelligence tests like intelligence quotient, which is mental age upon chronicle age in 200. This was devised by Binet and Simon. Stanford Binet scale of intelligence, it uses 10 subtests for assessing the intellectual and cognitive abilities, 5 cognitive factors such as fluid reasoning, knowledge quantitative reasoning, visual spatial processing, working memory. So whatever memory, our reasoning power, our knowledge power, our memory power, our visual observation power, our cognitive power, our motor skills, our fine skills, these are assessed by this Stanford Binet scale of intelligence. And it is also suitable for children from age of 2 years to adult of 85 years. So we see a very big range here where we can assess the intelligence of children up to the adults. Moving ahead, we have Bachelor scales, where uses a variety of components to determine a person's IQ score, including verbal, memory, perceptual, and processing skills. We have vocabulary, arithmetic, picture completion, block design, matrix reasoning, digit symbol coding, and symbol research. So these are the 4 parameters on which Bachelor scales, assesses the intelligence of persons. Then we have Kaufman scales, which is an assessment battery for children. It gives 4 global scores based on mental processing of composite and achievement, and it gives successive processing, mental processing, and achievement. Adult and adolescent intelligence scales are also used to assess the intelligence. So these are different scales we can use to assess the intelligence, whatever when a person is coming up with any behavioral or mental disorder. Then we have other personality tests in psychology, like Minnesota multifaceted personality inventory, Rorschach ink block test. This is a very famous test where certain images of ink is spreaded and an image is formed. When you sprinkle ink on a paper, certain image of that paper is formed, and looking at that paper, the patient is asked to analyze what he is exactly saying. Based upon that, you can assess the personality of the patient. This is a very common test used by a psychiatrist. Myers-Briggs type indicator, 16 PF personality questionnaire. It's a personality questionnaire. We need to answer different personality questions and we need to assess the personality of the person. Then we have behavioral test in psychology for ADHD tools like Conners rating scales. This is very important. Vendor-built ADHD diagnostic rating scale to test the inattention, hyperactivity, impulsivity, administered through questionnaires completed by parents, teachers, providing a comprehensive view of the individual's behavior. For autism diagnostic observation schedule, autism diagnostic interview revised is widely used. It involves direct interaction with the individual through structured activities that elicit social, communicative, and repetitive behaviors characteristic of autism. So this is very important. In cases of autism and ADHD, we need to use these rating scales and before the treatment and after the treatment to the case. I have also not personally used them, but I plan to use them if we get cases of ADHD and autism in our cases. We should keep these tests handy in our clinics, so that we can tell the patient that you need to do these tests and come up with the results. And after the treatment also, these tests needs to be repeated. Then we have diagnostic tests like different tests mentioned for like ADHD, as I previously mentioned also. Then we have this DSM-5. This is the main diagnostic manual which is used for psychological testing, for diagnostics and statistical manual of mental disorders, which classifies the mental disorders. Then we have observation screening tools, diagnostic assessment for autism, developmental assessments like Bailey scales of infant development, communication, and symbolic behavioral scales to assess a child's overall development progress and identify potential delays. So, with this, I can conclude that psychology is a very, very important and integral part of homeopathy system of medicine, should be included as a main subject, and all tools of psychology should be integrated in our practice to get maximum result and benefit from homeopathy. Thank you. That was all for today.
Thank you, Dr. Neha Kakkar. It's really a great session indeed. I must say the mother of our presentation from you, because of that much of power was the presentation. You really covered almost everything in the history of homeopathy. Dr. Hen, what was the how Henman become a psychiatrist like that, and what you really told the story how homeopathy built up gradually, and how it reached to the psychiatric level, and what is there in homeopathy, and everything were written, how the miasm is connected, how the treatment. Usually, a doctor who is practicing homeopathy used to present the papers on a clinical side, from clinical side, but you wrote just like an organon professor. Like that much of a depth was in your presentation. We really love this, and this kind of presentations are the need of the hour. Definitely, people will get more knowledge about homeopathy if you come up with if doctors, young doctors like you come up with the. I cannot never I can never thought of presenting such a thing from philosophy, but. Being a
Thank you.
practitioner, but
Yeah, but because as a student in B.H.M.S, we used to ignore organon the most. Organon is the part which we ignore, but it is the core of homeopathy. And I have again read organon, and all the aphorisms. If you read, every time you read an aphorism, you get a new insight, and it is very interesting to see how Dr. Henneman at that time, when the allopathy was the uh, main system of medicine, he advocated a new thing, a new approach. And that is what inspires us. If he can, then why not we have all the
yes,
knowledge,
yes,
all the tools, and we have all the medical knowledge. He at that
yes.
time, when the world was against him, he at that time took up this knowledge, and he advocated that we as a homeopath using homeopathic medicines can treat very difficult mental diseases, chronic diseases, and incurable diseases.
Yes, yes, exactly, exactly. Dr. Ramprasad sir, you can say in a few words. Please unmute yourself.
Thank you, Dr. Neha Kakkar. And
धन्यवाद.
Namaskar, Dr. Dhanesh ji, Dr. Indali Dekar ji. Very nice presentation. Neha Kakkar, IFPH, for your valuable presentation on mind and psychology. Very good. Describe the according to law of homeopathic science aphorism 210, 230. This is the Dr. Master Handman, organ of medicine 210 and 230, only mind patient. Mind,
Yes.
main cause of disease, mind, according to law of homeopathic science.
Yes.
According to law of Adhyatmic Shastra, main cause of disease, mind. Mind seeing a structural, pathological बीमारी.
Okay.
तो माइंड रामचरित्र मानस में महाकवि तुलसीदास जी ने लिखे हैं, सुनहु तात वो मानस रोगा, जिनसे दुख पावहि सब लोगा. हे भाई, मन का ही रोग है. मोह सकल व्याधि कर मूला, सुनते पुनि उपजय बहुत दूला. तो एक वैल्यूबल चीज, एक चीज माइंड का बहुत बड़ा काम, बात कप लोभ अपारा, क्रोध वित्त छाती जा रहा. एंगर बीमारी का कारण है, दाही प्रवृत्ति बीमारी का कारण है, पर सुख देखी जर्नी सोचे कुछ मन कटलाए. तो very thanks, Dr. Neha Kakkar.
Dr. Indra, you can say a few words.
Yes, sir. Okay, so should we conclude with a vote of thanks?
Yeah, no, you can say a few words on the presentation, and
Sure,
then
sure.
Dr. Sarvi
Sure,
will be saying a vote of thanks.
Dr. Kakkar, you have explained very nicely. The philosophical subject usually is neglected by homeopaths, because all we think that during passing only we require organ of medicine. We never apply them in practice. But really, it was a very nice study from your side, and you have taken good pains for presenting to us. So, like, we all are very happy. And also, I will say that we are expecting some more new topics from you in the organ in the future. So we are very happy about your presentation. Yeah. Okay, madam. Yeah.
And now I invite Dr. Sarvi Prasugar to say a vote of thanks to the session. Yes, Dr. Sarvi.
Thank you so much, Dr. Kakkar. It's a wonderful explanation from organon, some aphorism, and all of these aphorism very, very important. The psychological disease and one-side disease treatment is very important. And yes, you're right. I am agree with you. Every time we read organon, and later we learn a lot of things, and we clear our minds, treatment our patients. Thank you so much. And your session is very, very wonderful session. Thank you. Thank you, IFPH and Dr. Dhanesh.
Thank you, Dr. Sarvi, Dr. Neha Kakkar, and those who attend the session.
Thank you so much for listening to me and not getting bored also. Thank you.
Yes, really. It was a very nice presentation indeed. And tomorrow we will have a session from Dr. Deepthi Sharma, and the subject of discussion will be homeopathy intertaste syndrome. So hope all of you will be joining tomorrow at the same time, so that we can have a beautiful session in tomorrow also. Thank you all. Good night. It's over to Dr. P. Shaila to moderate the Malayalam session.